Eye Hospitals was established with a mission of making available to every individual the best of eye care solutions, irrespective of their awareness, knowledge, and financial levels, and for this purpose, to create a pool of trained and skilled eye care professionals whose skills and knowledge levels are at par with the best in the world. ASG has been started by AIIMS New Delhi experts, and there is a wide range of super specialty hospitals in Bhopal, Bhubaneswar, Bikaner, Dhanbad, Guwahati, Hajipur, Indore, Jaipur, Jamshedpur, Jodhpur, Kanpur, Kolkata, Ludhiana, Muzaffarpur, Nagaur, Nashik, Patna, Pune, Raipur, Srinagar, Surat, Siliguri, Udaipur, Ujjain, Varanasi. The venture also has its strategic presence internationally in Kampala, Uganda and Kathmandu, Nepal. ASG provides comprehensive diagnostic, medical and surgical eye care services through the latest technology. ASG has been awarded the Young Entrepreneur Award for the year 2013 by the Times of India. It has also been bestowed upon with the All India Achievers Award in 2009-2010. Recently, Rajiv Gandhi Gold Medal Award has also been received for medicine and management. The prestigious Business Goa Award for Corporate Excellence was recently awarded to ASG Eye Hospital. ASG Eye Hospital, as a top eye hospital in India, has successfully treated over 50 lakh patients till date and are pioneers of the latest technology of phacoemulsification and implantation of multifocal IOLs. Specialized treatment at the institute include advanced vitreoretinal surgery for the treatment of complicated retinal and vitreous disorders, glaucoma surgery, advanced corneal microsurgery, squint, oculoplastic surgery that includes treatment for different types of eye tumors, and cosmetic eye surgery. It has state-of-the-art facility for spectacle removal by one of the fastest available LASIK laser machine in the world. Today we take a look at one of ASG Eye Hospitals, which was launched 8 months back at Karanjale and has been getting tremendous response for its care and service. A state-of-the-art hospital boasts renowned doctors with in-depth exposure and experience. We speak to some of the doctors on the various diseases and cautions that we need to take care for a better vision. Dr. Sean Socrates da Silva has a MS degree with FCAS AEH, specialization in cataract, LASIK and cornea. He is the medical director at the ASG Hospital, Goa.
I'm Dr. Sean Da Silva. I'm the medical director at ASG Eye Hospital at Karanjale, and we are celebrating the World Health Day. The theme this year is on preventable blindness, and we're talking about various diseases in which early detection can prevent blindness and debilitating visual loss. One of the most important causes and the second leading cause of irreversible blindness is glaucoma. Glaucoma is a disease in which the intraocular pressure may be the main culprit in causing irreversible damage to the optic nerve. It is more common in individuals above 40 years of age. When it is detected early at birth or in infancy, it can be labeled as congenital glaucoma. However, that is quite a rare condition. What we are more looking towards is primary open-angle glaucoma and angle closure glaucoma. This is more prevalent above 40 years of age. The risk factors include myopia, diabetes, and in patients having a family history, it's important to have an early screening. These patients may be totally asymptomatic in the initial stages. The patient may not be able to be aware of any peripheral field loss. It's only when it is much advanced that the visual field damage can be significant. However, at that stage, the damage to the optic nerve can be quite severe and the visual loss may be irreversible. We advise patients to have a dilated retinal examination of the optic nerve and also an intraocular pressure check on a yearly basis after the age of 40 years. In early diagnosis, management involves using eye drops. These eye drops at regular intervals can help in lowering the intraocular pressure and maintaining the optic nerve in good health. In some conditions wherein the eye drops may not be able to lower the pressure, an intraocular surgery called as a trabeculectomy will help in reducing the intraocular pressure, and this prevents irreversible damage to the nerve. So the most common causes of blindness that we see on a routine basis is uncorrected refractive errors, cataract, and then we have the more irreversible causes such as diabetic retinopathy, glaucoma, age-related macular degeneration, and corneal diseases. With uncorrected refractive errors, we encourage mainly in the younger age group and children, once the child is able to read the alphabets, to have an early checkup and have a visual assessment as early as grade 1. These children have to have a regular visual assessment every yearly beyond that. Excessive exposure to digital devices, including mobile phones and computers, need to be regulated, and this can be one of the precipitating factors for a progressive myopia. Children and teachers in school need to be educated, and any child showing difficulty in seeing the board in the classroom or difficulty in seeing the distance needs to have an early examination. Cataracts, as we know, are more common in a much elderly age group. These patients will complain of blurriness in vision, or they may have glare at night while driving. However, with a simple surgery which involves removal of the cataract and an intraocular lens, the patient can restore back the complete vision. It requires a rest for 3 to 4 days and eye medications. Within a week, patient can be functionally back to work, back to office, or even resume all their day-to-day activities at home. With the other irreversible causes, I think diabetic retinopathy is something that needs to be taken seriously in all diabetic patients above 40 years of age, and glaucoma, in which there's an irreversible damage to the optic nerve, are the leading causes of irreversible blindness. We also have corneal diseases. The cornea is the window to the eye, and light entering the eye has to go through the cornea. In some patients, however, either by birth, called as congenital diseases, or in an elderly age group, either due to trauma, infection, or other acquired diseases, the cornea may lose its transparency, and this may result in complete blindness. However, this is labeled as corneal blindness because with a simple surgery like a corneal transplant, the patient can restore a very good functional vision and can get back to all his day-to-day responsibilities.
Dr. Chandraprakash Oli has a MBBS degree from GMC and MS Rio, FCAS from LVPEI Hyderabad. He is the consultant in PHACP, cornea, refractive QLASIK, ICL, bioptics and ocular surface disorder.
Hello everyone, my name is Dr. Chandraprakash Oli. I'm working as a consultant cornea, cataract and refractive surgery at ASG Eye Hospital, Goa. So today I'll be speaking about cataract. Cataract is one of the most common cause of blindness worldwide and also in India. So in cataract, what basically happens is the lens of the eye, which is normally clear and transparent like a glass, it slowly becomes white. And this is because of the age-related changes. There is a aging of the lens protein, due to which the lens becomes white. So at ASG Eye Hospital, we offer premium cataract surgery, wherein the surgery is painless. There is no need of any injections, no need for any stitches, and also the patient doesn't require to get admitted in the hospital. He can go immediately after the surgery. Also at our setup in ASG Eye Hospital Goa, we offer premium lenses, that is like toric lenses, multifocal lenses and trifocal lenses. These lenses will cover the distance and intermediate vision and the near vision of the patient, and patient can enjoy clear vision without glasses for both distance and near. And at ASG Hospital, we also offer a refractive surgery, that is the surgery to get rid of your glasses. In this surgery, what we do is, this surgery is also commonly known as LASIK surgery. In this surgery, what we do is basically we change the shape of the front part of the eye, which is known as the cornea, so that the light get focused on the retina, and this will help the patient to see clearly even without wearing glasses. So this facility is also available at ASG Eye Hospital Goa.
Dr. Aditya Kajave has a MBBS degree with MS, FERS AEH, FICO, MRCS, Edinburgh. He is the consultant in vitreoretinal, uvea and neuro-ophthalmology.
Hello everyone, I am Dr. Aditya Kajave. I am working as a retina consultant in ASG Goa. I am going to speak about diabetic retinopathy. So this is our eye model. This is how our eye looks from inside. So the anterior part, what you are seeing is a cornea, and just behind it is a lens. And the most important part at the back of eye is called as the retina. The retina is the structure where our vision is found. And retina is made up of millions of blood vessels. So diabetes affects these blood vessels. It can cause leakage from the blood vessels in the form which leads to retinal swelling, or it can cause closure of the blood vessels, which leads to new blood vessel formation, which are usually friable and can cause bleeding in the eye or cause retinal detachment. So diabetic patients who have very high sugar for prolonged period of time, they are at increased risk of developing diabetic retinopathy. The early changes of diabetes are usually asymptomatic, so the patient usually doesn't notice anything, but as the disease progresses, patient can see some signs and symptoms like he can have a decreased vision, he can have a fluctuation in vision quality, he can have black spots in front of the eyes that is called as floaters, or sometimes it can lead to the permanent irreversible vision loss. So the early changes of diabetic retinopathy are usually reversible, but as the disease progresses, it can lead to the permanent and irreversible visual loss. So the early diagnosis and proper treatment of the diabetic patient is very important. So the key factors which are important for the patient who have diabetes is a proper control of your blood sugar, blood pressure, cholesterol, have a healthy diet, proper exercise, and annual retinal checkup as advised by ophthalmologists will help to prevent the visual loss occurring because of the diabetes. Thank you.
The state-of-the-art OPD and wards are well maintained and gives excellent service and care for the patients, which in turn marks the speedy recovery. The hospital also boasts in-house spectacle store which caters to all the needs. The store provides unique collection which offers varied price points along with some renowned brands with after-sales service.
Hello, this is Subhashish Mohanty working as an eyewear consultant in ASG Hospitals. We are opening from last 8 months and we are having a very good response from our patients. So it's a very price according fully optical shop, you can say. And as compared with the prices, we are starting from the lenses is 650, it's up to 52,000. It's all according to your power and all. And we have a very good collection of frames that is also starting from 590, and it's up to the 20,000, 25,000. It's up to depends upon the designer brands that we have. We have the Ray-Ban, we have Omni, Versace, Tommy Hilfiger, the premium designer brands we have. And we have a very good options for the kids collections that is known as Hobby Nobby. It's our in-house product, and you will get it only in 1,500 to 2,000 in between. And we have a very good lenses of blue light protection that is comes with only 2,150, but it depends upon your power. If your power is not according to, then you will get it in 10,000 and 15,000. And I'm talking about the lowest brand what we have, that is MSO in our in-house brand we have, that is starting from 650, and it's up to 5,000 and 6,000 you will get it. And we have the premium segments, that what I'm talking about, the designer brands and all. And now we have options that we can put your power in sunglasses. If you having power, you are not using sunglasses properly, so we have options. We can put the power in the sunglasses so that you can use the sunglasses in outside. And lastly, I'm talking about the services what we have. We have a very good service of, normally people are giving the warranty of 1 year, but we have options of, if your power, if you're not comfortable with within 30 to 45 days, then we have options to we just change completely your spectacles and give it to back a fresh new. And for the lifetime you are having any alignment issues, any notch pad issues, we'll just do it free for lifetime for the alignments and that notch pads and all the things.
The hospital also has in-house pharmacy which caters to all the medicines required for the cure, thereby reducing the hassle that a patient would undergo.
Hi, my name is Shailaja Gangwar and I'm the pharmacist of ASG Eye Hospital. I look after the medications that we provide to patients coming in ASG Eye Hospital. The best thing about this hospital is that we provide consultation to opticals and pharmacy as well. Even after surgery, the medications are provided. Even from a minute to a major eye disorders, we provide everything from a minute allergy to glaucoma, cataract. We have all the medicines. The best thing about our hospital pharmacy is that it's in-house pharmacy. The company are Nova and Berry and Herbs, which provides all range of medications to us.
ASG Eye Care Hospitals has ambitious plans for itself. A venture started by AIMS alumni is spreading its wing not only in India but also abroad. The quality care and service is the highlight of the brand.
Hi, my name is Harshita Vishwakarma and I am working as the Operations Manager for Goa Center. ASG Eye Hospital is a leading group of tertiary eye care providers in India and abroad. It was started in December 2005 by two young postgraduates from AIMS, Dr. Arun Singhvi and Dr. Shashanka. Their vision was to make available quality ophthalmic services to population residing in Tier 2 and Tier 3 cities at an affordable cost. Today, we have a presence in more than 40 cities in India, with one in Nepal and one in East Africa. We started our center in Goa in August 2021 with an expert team of 5 doctors with an experience of more than 21 years. We are the only eye hospital in Goa having all ophthalmic services under one roof. We are equipped with the best infrastructure and state-of-the-art facility, catering to services ranging from cataract, cornea, glaucoma, retina, oculoplasty, squint, pediatric ophthalmology, neuro-ophthalmology, and all other ocular surface disorders. We have our in-house pharmacy as well as optical. In the past 8 months, the response from the Goa clientele has been tremendous and overwhelming. We received a lot of positive feedback from you all, and we look forward to serve you whenever you need us.
Now let us listen to some of the patients who have been cured at the ASG Eye Hospitals.
This new hospital, since I heard it on the radio and to my friends, I came and immediately I got an appointment, and the staff escorted me everywhere, wherever they wanted, and the staff was very nice, very helpful, very cooperative. I had my surgery on Friday, and the surgery was just 15-20 minutes, and after the surgery, I went, and the people couldn't believe that I had a surgery. I was just normal. My eyes were both normal, and I was feeling great, and I was feeling nice. And now the lenses are so good, and I don't need specs. I can read even the smallest letters without the specs. And the staff are fantastic, very good staff for all the people to come and do the surgery here on this hospital, ASG.
I was referred to this hospital, ASG, by my friend, and he suggested me that he had gone here for a regular checkup, and he suggested me Dr. Oli's name, Chandra Prakash Oli. And when I came, I had a severe cataract problem, which was a lot of difficulty for me. And when I came here, I was checked by Dr. Chandra Prakash. After having the checkup done, I was counseled by whose name was Viveka, and she also put in a lot of efforts and explained to me exactly what is gone wrong and all the different types of lenses which were available. And I was having a lot of problems to decide on what to select and all. But due to her explanation, I was in a condition where I could choose the lenses which I could go forward for, and that made my operation very successful, and I am very happy. I could ride my bike even on the very next day, you can say. So I was very happy about this.
I was wearing glasses since standard 5, and my number was minus 3.75 and 2.75. But from ASG, I have decided to do a LASIK operation. I consulted with Dr. Oli, and after the surgery I feel very good, so that I can see very well,
For complete eye care and hassle-free service, visit ASG Eye Hospitals at Dr. Jack De Sequeira Road, about Audi Showroom, Karanzale.